My name is Scott Hultman. I'm a professor of plastic surgery at Johns Hopkins. I'm also the associate chair of strategic development here for the Department of Plastic Surgery. You're listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Scott Hultman, professor of plastic surgery at Johns Hopkins University, where he serves as vice chair of strategy and director of the Johns Hopkins Bird Center. He is the former Ethel and James Volin Distinguished Professor of Surgery at the University of North Carolina, where he served as chief and program director for plastic surgery, vice chair of finance for the Department of Surgery, chair of the Graduate Medical Education Committee, and chair of the Patient Complaints Monitoring Committee. The author of more than 180 scientific articles, reviews, and chapters, plus the editor of 4 medical textbooks, Dr. Hultman has mentored more than 50 surgeons during various stages of their academic careers. Nationally, he is a recent past president of the American Council of Academic Plastic Surgeons, and he currently serves on the ACGME Plastic Surgery RRC, where he has helped to develop novel competency-based training programs.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Scott Hultman, professor of plastic surgery at Johns Hopkins. Doc, how are we doing today?
Fantastic. It's great to be here.
Thanks for joining us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
Well, to help answer that question, we got to go back to medical school because I had a very unusual route to become a plastic surgeon, specifically a burn surgeon. I went to medical school thinking I might be a psychiatrist or a neurologist. And when I actually did those rotations, I found that they just weren't that stimulating or satisfying clinically. What I found myself really gravitating toward was surgery, which was a complete surprise. And on top of that, plastic surgery. And specifically, there was one case that got me really pumped up to become a surgeon, and that was a jaw reconstruction where we took the fibula bone from the leg, brought it up, reshaped the jaw, and reconstructed this guy's face. And when I watched the operation, I actually was there with the ENT service, and I saw the plastic surgeons come in, and I had no idea who they were. And I thought it might be orthopedics or something like that. And I asked, who are those guys? Because that's what I want to do. And they said, oh, those are the plastic surgeons. And what blew me away is that I thought plastic surgery was all about Botox and liposuction, but I had no idea that there was this whole other world of reconstruction. And so I decided within 24 hours that this was what I had to do with my life. So to answer your question, I decided to go the traditional route in training. I did general surgery first. And once I got embedded into general surgery, I got really interested in burn care and burn reconstruction, which led me to take 2 years off and study the basic science of burn injury, wound healing, and immunology. And while I was actually doing my lab years, an opportunity became available to do a critical care burn fellowship. At the time, I wasn't really excited about spending more time away from plastic surgery, my ultimate goal, but I had great advice from one of my mentors, and that was, this critical care fellowship will provide you with a totally unique perspective on plastic surgery. And you may be one of the only critical care plastic surgeons in the country, so go for it. And I haven't regretted that. And that's been sort of my pursuit ever since. But I've always moved toward trying to be the best, burn plastic surgeon possible, whether that's providing critical care or complex reconstruction in the operating room.
So taking us through your fellowship, what was your mentality heading into your first job search, and how did that perspective change in the beginning years of your career?
Well, I had gotten advice from old people who had gone before me to apply broadly to different types of opportunities. So I did that. I did know that I wanted to do academics by this point. I realized that to do the kind of work I really loved and was passionate about, I would need to be in a great burn center with a great division of plastic surgery and a great chair of surgery who would support my development. So that really focused my opportunities to really a few centers in the country. Fortunately, I was recruited back to UNC, Chapel Hill, where I had done general surgery, and the new chair of surgery had actually trained me and mentored me in his lab. So I had a really good mentorship outside of plastic surgery set up. But one of the things I did, though, that was a little bit unusual is I did look at a lot of private practice jobs. as well as academics, because I wanted to make sure that I was still making the best decision for me and my family. So for example, I interviewed for a private practice job in Springfield, Missouri, where I was offered an obscene amount of money. And so I had that first, aha moment where how much does money factor into my decision? And at that time, I was really committed to academics. And so although the money was great at Springfield, Missouri, it was getting me further away from my goal of becoming a burn plastic surgeon. So I had to say, you know what, I'm going to turn that down. But, periodically I did interview in plastic surgery, private practices throughout my career, either with friends or new opportunities that were opening. And I have to say that the appeal of doing private practice increased over time. And it's because of the autonomy and independence that you have in private practice that you really don't have in a group practice or an academic practice.
What would you say were some of the keys of your success that shaped your early career as you climbed to the top of your industry?
Well, definitely I wanted to establish myself clinically first and foremost. So I did every case that I could. I never said no to a case or to a patient. I wanted to really develop my own skills and become the best surgeon that I could be. And I knew that there would be a learning curve in the first 2 years after practice or even beyond. And so I wanted to establish my clinical reputation first. Once I did that, I was able to then ask probing questions that could then impact my research interests. So, for example, in burn surgery, looking at hand reconstruction, how important is nerve reconstruction to the outcomes of these patients? And so by having a good clinical practice, I was able to ask the right research questions. And then as I got my local reputation built, that's when I reached out regionally and nationally to develop a larger reputation.
What advice do you have for the graduating chief residents and fellows entering the professional job market for the first time?
Well, I would say, first of all, stay diversified. Just like, you're investing in stocks, the best returns are going to be if you have a broad portfolio of stocks and bonds, because you can't really predict where your career is going to go and what the environment's going to be. So I would say, don't focus on any one area just yet. That's okay to have your passion and to pursue that dream, but make sure you can do the basics. I mean, I've now lived through two economic crises, the recession of '08 and then the current crisis of the markets that's been induced by COVID. And so both times, reconstructive surgery has been sort of a safety area for our business, both in terms of just staying busy with operating on patients, but also financially. Whereas during the boom times, cosmetic surgery may have a better yield if you're only after the financial components. So I would say definitely make sure you've got a broad training and you keep your hands in a lot of different areas in your specialty.
Can you talk about your involvement with the American Society of Plastic Surgeons?
Yes, it's been an amazing year for me this year. I am finishing up my presidency as the president of the Plastic Surgery Foundation. Now, this is the research and endowment arm of the American Society of Plastic Surgeons. I didn't set out to become the president, so let's get that clear. I sort of found my way into it based on the work that I had done and the kind of activities I liked at a national level. So what does that mean specifically? I actually got involved in the ASPS about 3 or 4 years into my practice when one of my best friends from residency asked me to help him chair a committee. I liked the committee work. I was pretty good at it. I managed to get a spot on the board of directors as a young plastic surgeon, which is actually the category that I was in at the time, YPS. I'm not in that category anymore now that I'm in my 50s. But that allowed me then to become an associate editor for our trade journal. And I rose up over about 10 years to become the editor-in-chief of that journal, which was an amazing view of the organization from a outside perspective. I wasn't the one making policy or doing major committee work, but I was reporting on that. And I was interviewing our leaders. I was interviewing patients and providers. And so that led me into additional opportunities I ended up chairing the Finance and Investment Committee. I just finished business school, and that was a springboard to get on the executive committee and the board of directors. So I just kept, moving to the next step and ended up in the position that I am now. It's been a great year.
With everything being done virtually right now and conferences going online, what advice do you have for the graduating class regarding networking and their outreach process?
Yeah, I think that's a really good question. We're seeing this play out right now. So we're sort of making it up as we go. We're having a virtual meeting for our national meeting. So that's a disappointment to me. I won't be there to meet and greet all the members. But what is interesting, there are other opportunities with this. So although the networking may not be as robust, for example, the exchange of information will be phenomenal. So this year, we're offering 75 CMEs to our participants, which vastly exceeds the amount of educational content in the past. You couldn't go to 75 hours worth of programming. This year you can, and you'll have several months to do that. So why is that helpful this year and at this time? Well, this is an opportunity for the young graduates or the people who are finishing their training to really take a deep dive in content. As a young plastic surgeon finishing my training, I didn't have that luxury. I didn't have the money, and I didn't have the time to learn about all the things that I missed out on or had gaps with in my training. So this is a way for our graduating residents to really learn about all those areas that they just didn't have exposure to as a resident. So I would say, take advantage of this opportunity. Something like this won't happen again. The networking will come. So just be present, be active, be available.
What are some of the biggest mistakes you see young surgeons making as they go into their professional career?
Yeah, I think a couple things. First of all, always think about 2 or 3 steps ahead. So some of the advice that I got when I was interviewing for residency was think about where you want to have a job. So I used my plastic surgery interviews for residency as a way to think about job opportunities and meet the people who might be my future bosses, 5, 10 years down the road. You will have career twists and turns. I'd been at UNC Chapel Hill for 18 years. I was getting settled in. I didn't think anything would change, and I would just ride that out for the next 12 plus years. But, life happens, and you change as a person. Your place changes, and I found that I had this amazing opportunity at Hopkins that came available. So be prepared to have changing expectations. The other thing that I would tell people is, even though it's not about the money, you have to consider the money. And let me explain that. Certainly if financial independence and autonomy is one of your goals, then I think private practice is probably better suited for that, perspective. However, even in academics, your compensation is really important. You want to know that that you're valued as a surgeon. You don't want to be taken advantage of. And you really have to look at the incentive plans that are present in academics. They have to be fair and they have to be transparent. And one of my frustrations at my previous job was that, I had young surgeons that I was grooming and training, developing, but yet they could not increase their take-home pay by working harder. It was very difficult to do that. And so it was hard to keep senior or mid-level surgeons on my faculty at that time. Hopkins is a little different setup in terms of the way that the incentive plan is organized. And so there's more of an opportunity. If you want to work hard and have additional take-home pay, then you can have that. If you want to focus on, let's say, the academic side of your career and write grants, papers, then you can do that as well. And you can have more autonomy. So money does factor in, even if you think you want to do academics. I would say that, again, to reiterate about the point that your career will change dramatically over the arc of your decades of practice. So that's why it's so critical to be strong and skilled in a basic set of principles that you can fall back on. And a good example, if you look at my career, I started out doing breast surgery, microsurgery. I then, and as well as I did critical care of burn patients, I developed my burn reconstruction practice over 1 to 2 decades. I started to zero in on that. I then discovered the value of actually non-operative therapies like lasers, fat grafting, which is minimally invasive for burn reconstruction patients. So I found that even though I was still focused on reconstruction, I was taking elements from aesthetic surgery and applying them to my burn patients in ways that had never been done before. And it was a really exciting thing to add to my, armamentarium of what I could do to help a patient. And then it's really come full circle because here at Johns Hopkins, I'm now running the burn center, and we just started a new burn surgical critical care fellowship. So I had to retake my boards, which I passed in critical care. We had to apply for a new fellowship with the ACGME, get funding internally, and we just got approved actually yesterday. So our new fellows are starting on September 1, and we'll be one of the only programs in the country that offers this burn critical care by plastic surgery. So not to sort of highlight that, but pick an area where you think you can innovate and where you can grow, where you have opportunities. You may not know exactly where you want to go, but you will learn it along the way. And so fortunately at Hopkins, we had this amazing opportunity for plastic surgeons to run the burn center and now provide critical care for the whole hospital. That wasn't part of my plan, 20 plus years ago when I was looking at jobs. So one question that I get asked by our residents is, should I do a fellowship? So we've got the plastic surgeons who have trained now for 6 or 7 years. Do they need subspecialty training? I would say that it depends on what your goals are. If you are trying to market yourself as a hand surgeon or as a cosmetic surgeon, then having that extra year-long fellowship, yes, that's very helpful. But I can guarantee you, if you finish an accredited training program and you do well, you will have enough skills to focus on anything that you want to do. There may be a different learning curve when you're in practice, but you don't have to necessarily continue with that training. Part of it is you'll never feel ready when you start your practice. You'll always feel like you've got some area of deficiency or area that you haven't quite mastered. That's totally normal. That's natural. In fact, that's almost intoxicating, because one of the things I really found myself loving in the operating room was doing cases I'd never done before or even seen before. Where you read up about the flaps, the blood supply, the goals of the operation, and you're doing something for the first time. Of course, you have to be fully open with your patients and tell them that, hey, this is a unique situation. But for me, that was an amazing rush. But I think that's why those of us who do plastic surgery are attracted to this field, because it is so creative and so innovative. And so I would also say that patient care is the easiest part of what we do. Cutting, sewing, closing, putting things back together, that is the fun part. So I would say don't ever let go of that part of your job, because that's what you'll always find will give you joy and fulfillment when you do go through tough times. So you may have a tough boss. You may have, a tough market that you're trying to deal with, and patients aren't coming into your practice. But if you're able to really love what you do, i.e. in the operating room, that's your place of refuge where you can go, and all the other problems outside of that OR sort of disappear. But I would say, don't ever lose track of, taking care of patients, because that's ultimately why we're here. This might help people see the big picture. I never knew the big picture. I'm learning it now that I'm in my 3rd decade of practice. So when you start your career, I know it's hard to think about the end, but you do need to consider the entire arc of what you do. For me, I'm looking now at the first decade, the middle decade, and the last decade. And that first decade, I worked really hard. I wanted to establish my name, my reputation, and I wanted to learn all that I could. The second decade was a decade of sort of exploration of new ideas. I think that's where I was probably my most innovative. Actually, I had this crazy idea to go to business school to become a better chief of plastic surgery. And I'm really glad I did, because I learned about things that I'm now applying to my practice. And in my last third of my decade, this is really about having fun and being a role model for younger surgeons and giving back to my specialty. So there are different focuses in different arcs of your career. And so I would say, think about that next step, think 2 or 3 steps ahead, what you want to be doing, and ask yourself, what can I do differently that will allow me to stay inspired for the rest of my career?
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.